Have you ever experienced a sudden and painful contraction of your muscles, usually in your legs or feet? If so, you have probably had a muscle cramp. Muscle cramps are very common and can affect anyone, regardless of age, gender, or fitness level. But what actually causes them? What do they feel like, and how can you treat them at home? In this video, we will answer these questions and give you some tips to prevent and relieve muscle cramps. We will also debunk some common myths about muscle cramps that you may have heard. Let's first start by what causes muscle cramps. Muscle cramps are involuntary spasms of one or more muscles that last from a few seconds to several minutes. They can occur for various reasons, such as number 1, overuse of the muscles, especially after intense or prolonged exercise. Number 2, dehydration or electrolyte imbalance, which can affect the fluid balance and nerve signals in the muscles. Number 3, poor blood circulation, which can reduce the oxygen and nutrient supply to the muscles. Number 4, muscle fatigue or injury, which can make the muscles more prone to spasms. Number 5, certain medications such as diuretics, statins, or asthma inhalers, which can interfere with the muscle function or cause side effects. Number 6, medical conditions such as diabetes, thyroid disorders, kidney disease, or nerve damage, which can affect the muscle metabolism or nerve function. Some people also may be more susceptible to muscle cramps than others, such as older adults, who may have less muscle mass and flexibility. Pregnant women, who may experience hormonal changes and fluid retention. Athletes, who may exert their muscles more frequently and intensely. And finally, people with flat feet or high arches, who may have more stress on their calf muscles. So now, what do muscle cramps feel like? Muscle cramps usually feel like a sudden and sharp pain in the affected muscle, which may also feel hard and tight. The pain can be mild or severe, depending on the intensity and duration of the spasm. The most common sites for muscle cramps are the calf muscles, the back of the thigh, also known as the hamstrings, the front of the thigh, also known as the quadriceps, and the feet. However, any muscle in the body can cramp, including those in the arms, hands, abdomen, and chest. So, how can you treat muscle cramps at home? Most muscle cramps are harmless and will go away on their own. However, they can be very uncomfortable and interfere with your daily activities. So, here are some things you can do to ease the pain and relax the muscle. Number 1. Stop the activity that triggered the cramp and gently stretch the affected muscle. Hold the stretch for 15 to 30 seconds and repeat until the cramp subsides. Number 2. Massage the cramped muscle with your fingers or a foam roller to improve blood flow and reduce tension. Number 3. Apply heat or cold to the cramped muscle to soothe the pain and inflammation. You can use a heating pad, a warm towel, a hot water bottle, an ice pack, or a cold compress. Number 4. Drink plenty of fluids to rehydrate yourself and replenish your electrolytes. You can drink water, sports drinks, juice, or milk. Avoid alcohol and caffeine, which can dehydrate you further. Number 5. Take over-the-counter pain relievers, such as ibuprofen or acetaminophen, if the pain is severe or persistent. Follow the directions on the label and consult your doctor before taking any medication if you have any medical condition or allergy. Now, how can you prevent muscle cramps? Well, muscle cramps are not always preventable, but there are some things you can do to reduce your risk of getting them. Number 1. Warm up before exercising and cool down after exercising to prepare your muscles for activity and prevent injury. Number 2. Stretch regularly to improve your flexibility and range of motion. Number 3. Exercise moderately and gradually increase your intensity and duration. Avoid overexerting yourself or doing unfamiliar exercises. Number 4. Stay hydrated and eat a balanced diet that includes foods rich in calcium, magnesium, potassium, and sodium. These minerals are essential for proper muscle function and contraction. Number 5. Wear comfortable shoes that fit well and support your feet. Avoid wearing high heels or tight shoes that can strain your muscles. Number 6. Change your position frequently if you sit or stand for long periods of time. Move your legs and feet often to improve blood circulation. Now you may be thinking, when to see a doctor? Well, muscle cramps are usually not a cause for concern, but sometimes they may indicate a more serious problem. So you should see a doctor if your muscle cramps are frequent, severe, or last longer than 10 minutes, or they are accompanied by swelling, redness, bruising, or infection. You should also talk with a doctor if your muscle cramps occur along with other symptoms, such as fever, nausea, vomiting, weakness, or numbness, or if you have a medical condition or take a medication that may cause muscle cramps. Your doctor may perform a physical exam and order some tests to determine the cause of your muscle cramps and prescribe the appropriate treatment. Now let's get to some common myths about muscle cramps. There are many myths and misconceptions about muscle cramps that you may have heard from your friends, family, or online sources. So here are some of them and why they are not true. Number 1. Muscle cramps can be cured by eating bananas, pickles, or mustard. Bananas, pickles, and mustard are rich in potassium, sodium, and vinegar, respectively. These substances may help replenish some of the electrolytes that are lost through sweating or urination. However, they are not enough to prevent or treat muscle cramps. There is no scientific evidence that eating these foods can stop or prevent muscle cramps. The best way to treat muscle cramps is to stretch, massage, and apply heat or cold to the affected muscle. Number 2. Muscle cramps are a sign of dehydration or electrolyte deficiency. Dehydration and electrolyte imbalance can contribute to muscle cramps, but they are not the only or the main causes. Many people who are well hydrated and have normal electrolyte levels can still experience muscle cramps. Muscle cramps can also be caused by other factors, such as overuse, injury, medication, or medical conditions. Number 3. Muscle cramps can be prevented by taking quinine or magnesium supplements. Quinine is a drug that was originally used to treat malaria, but it has also been used to treat muscle cramps. However, quinine has many side effects such as nausea, vomiting, headache, ringing in the ears, and blurred vision. It can also interact with other medications and cause serious complications such as bleeding disorders, heart problems, and kidney damage. Quinine is not recommended for treating muscle cramps and should only be taken under medical supervision. Magnesium is a mineral that is involved in muscle contraction and relaxation. Some studies have suggested that magnesium supplements may help prevent or reduce muscle cramps in some people, especially those who have low magnesium levels or who are pregnant. However, the evidence is not conclusive and more research is needed. Magnesium supplements can also cause side effects, such as diarrhea, stomach upset, and kidney problems, so they should not be taken without consulting your doctor. At the end, muscle cramps are common and usually harmless, but if your muscle cramps are severe, frequent, or accompanied by other symptoms, you should seek medical attention as soon as possible. Thanks for watching.